And first we'll just start with Lena and Heather introducing themselves. Lena, you want to start us off?
Sure. I'm Lena Tucker-Reinders, and I am the executive director of the Iowa Public Health Association. We're the Iowa affiliate. And so I've been in this role for almost 4 years, 4 years this spring. I have a master's in public health is my training, and I have background in health equity policy. So I've kind of subject matter kind of across the gamut. I worked in local public health, state health departments. I was with the World Health Organization for a while in Geneva. And I've been here in Iowa for about 10 years. I call Minnesota home, but have been here for about 10 years.
Geneva to Iowa, that's a big range. Go ahead, Heather.
Hi, everybody. Nice to meet you all. I'm Heather Drake. I'm the Membership and Engagement Director with the Maine Public Health Association. I also have an MPH from the George Washington University. I know somebody else said they were going there. So great school. We are one of the affiliates of the American Public Health Association. We're a staff of 2, so we're pretty small. And I think we can talk more about affiliates, but they do vary in terms of staffing across the country. We do advocacy and professional development work mostly at our affiliate. And I, just in terms of background, have worked mostly in community level public health work. I've done work on safe routes to school, active living, cancer prevention, substance use prevention. And so my background is mostly in program planning and chronic disease prevention, but I also do a lot of facilitative work as well, bringing together coalitions and networks.
Fantastic. Well, yeah, if the two of you wouldn't mind sharing a little bit more about what is an affiliate, how does it work, in your understanding from, different ones, they might all look very different. If you can share kind of that range. You mentioned staff. Do they all have staff? How do you work as a council? All of those good things just on functioning and process, I think would be helpful for some of us on this call.
Sure, I'll go ahead and jump in. I saw Heather just take a drink. So I believe there are 52 state affiliates, which maybe sounds a little confusing, except that under the umbrella of state, we also have our territories as well. And so there are affiliates in all 50 states and a couple territories. And we are collectively, we are the Council of Affiliates. And so that means that we do have a formal agreement. We are all independent organizations, nonprofits, but we do have an agreement with APHA, and there's that allows us to use the APHA branding. We get support from APHA in terms of staff support. We don't get financial support. We are all financially independent, but there is an affiliate staff team. I believe it's a team of 3 or 2 staff and an intern that help us navigate different issues. We engage in policy. We have, in terms of relationships with APHA, we have a monthly Council of Affiliate call. A member of the Council of Affiliate is also a member of the executive board. And then each affiliate has it's called the ARGC, or the affiliate representative to the governing council. So each affiliate has a vote on governing council matters. So that's kind of the formal relationship with APHA. I also serve as the staff liaison to the council affiliate. So you asked about how many affiliates have staff. I would say it's about a third. What do you think, Heather? I forget the exact number, but it's growing, which is great. It's great to see that number is growing, because as you can imagine, having an all volunteer organization versus a staffed organization, there's just enables you to do more things, execute more of your mission. So in Iowa, our affiliate's mission is to unite and strengthen the voice for public health in Iowa. And we do that primarily through education and advocacy. I am a lobbyist at our state capitol. We put on an annual conference and monthly lunch and learns. And we also do social events throughout the year. We are a big geographic state. We don't have the largest population, of course, but we have a lot of area to cover. And so we have different social events throughout the year, mostly in the summer because we do get snow and winter driving conditions. And then we partner with different organizations around the state. So we partner with our state health department. We partner with the University of Iowa, which houses our College of Public Health. We partner with community organizations and such. So, and one of our partners, particularly, which is why I volunteered to come on this call, is we have a strong relationship with our Environmental Health Association. So the Iowa Environmental Health Association is the state affiliate of NEHA, National Environmental Health Association. And so we do quite a few activities together with them. But I'll save that for the next question and let Heather fill in the gaps that I left.
I don't think you left too many gaps. I'll just say, again, kind of stressing that we're all different in terms of staffing, even affiliates who do have staff. You might have one staff, you might have part-time staff, you might have 10 staff. So that really impacts the ability and what you can do. I'll also say, Lena did mention it, that we're not really tied to APHA in any terms of agenda, which is really nice because then we can, as affiliates, really respond to the needs of our state, and it's not dictated to us from a larger entity where other associations that might be the case. So there's a lot of leeway in how we can address public health in our own state, which is, I think, really important, given that it is so very different in each state, and especially depending on what the political landscape looks like for everybody. So I think that's one of the things that's really nice about the relationship that the affiliates have with APHA. And then, of course, APHA provides, a ton of guidance, especially when it comes to federal policy, and make sure that, we're prepared to engage with our federal delegation if we'd like to as well. So I think that's super helpful. And I'll just add a little bit more about MPHA. So we are a staff of 2. It's myself and our executive director, and she is also a registered lobbyist, and she can't be here because she's trying to talk to a senator and get him to understand about cannabis and why it's important for young people not to use it. But so our mission is to improve and sustain the health and well-being of all people in Maine through health promotion, disease prevention, and the advancement of health equity. So we do that very similar to Lena. Through our advocacy work, our policy initiatives, we try to really get our membership involved in advocacy and education as well. Sometimes there's some hesitancy there because of where grant funding comes from. We hold an annual conference every year, which usually draws online or virtually. It was drawing around 300 people, and in person, we usually get about 400. We are also a very big state. And so that makes our work difficult at times, just to make sure that we're reaching everybody and the different public health needs across the state as well. And we are very rural, and our rural is a little different in that we have a lot of people living in those rural areas. So where you might have a Montana, where it's also, I think that might actually be the most rural state, but everybody's congregated in the city and the town centers. In Maine, people are much more spread out. So that means that there's a lot more work to do in getting to people as well. What else? We do professional development activities. So we partner with different organizations and hold webinars throughout the year and different trainings to meet the needs of our members. We try to do issue briefings to make sure everybody's up to date on the policy and advocacy priorities that we're working on. And we also partner with the New England Public Health Training Center. I don't know if folks have training centers in their regions, but those are a great resource. They're sponsored by HRSA to get more professional development and education and training and continuing education credits on a variety of public health topics. So that's one of our valued partnerships. And we are also, and I'll talk about this more too, part of tons of different coalitions. That's how we try to expand our capacity, is by being on coalitions that address various topics. But one that we're very involved in is the Environmental Priorities Coalition, which is a group of climate and environment stakeholders in Maine. But I'll save that one too.
Great. That's really helpful to hear. And you all are quite busy for tiny staff. And lobbying capacity mixed in there. So yeah, you both kind of segued us to, you know, how does this work in terms of doing environmental health work? This is the environment section. So everyone on this call is concerned with, you know, specifically environmental health issues, but we know that funding and capacity across all of our states varies substantially when it comes to, I know just within Michigan, our different local health departments, some are able to tackle environmental health issues much more than others. And so there's a lot of gaps to fill in. And I'm curious what that looks like from the State Public Health Association lens, and how you two do this work, and why the council sent you to us of all the different states.
Well, I mentioned that we partner quite a bit with our Iowa Environmental Health Association colleagues, and there's a lot of crossover there. However, in Iowa, I had one of those light bulb moments just a few months ago, really, in planning our conference, because I realized that we're debating the number of sessions and the tracks we were having and such, and so we committed to having an environmental health track. And what I realized was brought to my attention was that so many of the people that are members of the Iowa Environmental Health Association are in the classic sanitarian role, where they're doing pool inspections, tattoo inspections, and such like that. And so a lot of their CE needs in that kind of very protocol driven kind of inspections work is met through other means. And so we weren't getting the numbers that we wanted to see at our conference, because the sessions that we were promoting were much more climate justice, water, you know, kind of the higher, or I shouldn't say higher, but maybe broader policy areas. And so we worked with the environment, again, our partners at the Environmental Health Association, who we co-sponsored the conference with, to develop a track that met those the immediate needs, the professional development immediate needs, but also kind of nudged people that work in environmental health officer positions at our state and local health departments, to think of those bigger picture issues as well. So if I can screen share, I'll just show you what our conference tracks are looking like, so you can kind of see how we're trying to marry that. But am I able to do that? Yeah, great. And so this is, we have an abstract, people submit abstracts, and then we review and select. So the ones in green here are the environmental health track. So you can see it runs from pesticides to lead poisoning, geologic carbon sequestration, which I will admit I don't know what that means, but I'm sure you all do. Some of the interesting ones where we get into policy issues, I said, like, I'm a lobbyist, is this one over here, this cottage food 101. And so we have a perpetual bill in our legislature about raw milk. So there's a training session on that one. This is day 2 now. Herbicide use, as you can imagine, Iowa is a very agricultural state. And so we are concerned about pesticides, herbicides, and, you know, the algae blooms in the Delta, you know, often much of it originates, you know, in our farms in Iowa. So trying to kind of nudge conversations on that. We have kind of an unofficial motto that, you know, when we can't be policy changers, we want to be conversation nudgers. And so you can kind of see where we are at. We're trying to bridge that gap between the kind of the needs of the classic sanitarian and these bigger policy, climate change and environmental justice type issues. So that I would say that's our biggest area. We share, when it comes to the state capitol and the legislature, we you know, share our policy agendas. We can connect on bill tracking. If there's an environmental health bill that we would have a particular helpful voice on, and vice versa, we do that. Our lobbyists talk to one another. And in fact, just today, actually, a member brought to my attention the new the grant opportunity that the Biden administration just released about the environmental justice funding opportunity. So we're going to be looking at seeing how we can partner to again bring some of these environmental justice, climate justice kind of issues to the forefront in Iowa. As an ag state, as you can imagine, it's a pretty sensitive subject area because our farmers, the farm economy, our legislative and governor makeup are very protective of our ag, of our farmers and our agricultural industry. And so, whereas again, this is kind of gets back to, when we can't be policy changers, we're conversation measures. And so making sure that these issues are brought to public health, brought to the public at large, and to the media. I have a pretty strong relationship with the media. And so when we can get a good talking point out there and help move the conversation, we do.
Fantastic. And I appreciate too hearing the different local contexts, because I'm sure it's making me think of, my own local context. So go ahead, Heather.
Thank you. Yeah, and this has been fun for me too, because I feel like we talk a little bit more broad level sometimes with each other's affiliates. So it's nice to hear, Lena, what you guys are working on in this field. So we engage in different ways in climate and the environment. We have a climate member section. So those are set up similar to APHA's member sections. The one thing that we struggle with the topic is that a lot of our members are interested in it on a personal level, climate and the environment, but they don't necessarily do it in their day-to-day work. So it's a smaller group because they can't dedicate time during their workday to work on something that's out of their purview. But they are mighty, and they right now are working. So we have, it's called the Maine Climate Council, which is working to reduce emissions. And one of the recommendations out of there that was not taken up was to work with healthcare systems around environment and climate. So our member section is pulling together a peer learning forum for healthcare systems and associations to work on sharing resources and learning about sustainability, climate change, climate preparedness, and how to adapt and mitigate to the changing world that we're in, because healthcare systems are one of the largest or larger emitters of emissions. So that's one thing that we're doing, sort of like a direct project. And then otherwise, most of our work comes on the policy and advocacy level. So we try to look at the different bills that are in front of the legislature and which ones impact, which environmental bills impact public health. So we've done a lot of work around PFAS, and we're partners with Defend Our Health, which is an organization here in Maine. We actually had a call with them this morning to learn about some of their priorities around PFAS and other toxins. So we've submitted testimony and done work on that topic. We've also done worked on things like banning balloon releases. So we try to, really scan the bills and the legislation and look for those public health crossovers. And then, and we've also promoted the Climate Corps too in Maine as well. And then, as I mentioned, we're part of the Environmental Priorities Coalition, which is a group in Maine, and I'll put their website in the chat if people are interested in looking at it. And that's a group of over 30 organizations right now that are environmentally and climate focused. And they come together every year, and it's kind of a fun activity and a fun process where everybody gets to put forward, if they want, a bill that they want the entire group to get behind and set as their priority. So the Environmental Priorities Coalition has this common agenda that everyone agrees to. So it really gives a lot of clout to those issues, because then you can say we have 30 plus organizations who are behind this, and then everybody comes together to deliver testimony and write letters to the editor. So we're part of that, and that's been really helpful in enabling us to have a stronger voice in environment and climate, but also to educate all those folks and organizations too about the importance of public health and the crossovers between the environment and climate and public health. So that's been really great. One of the bills we tried to get the group to get behind and just couldn't quite get there is around banning flavored cigarettes or tobacco products. So yes, there are all the public health concerns about it too, but it's also an environmental concern because of the way that there aren't regulations around disposing single-use cartridges and other paraphernalia used to smoke flavored tobacco products. So we try to bring in that public health lens to a lot of the different issues, but we have been able to get some of the environmental groups to help us and back us on those topics as well. Similarly, cigarette butts, that was another thing that we were able to get the group to educate them more about the environmental impacts of litter. So that's been really helpful in a way that we've been able to take a bigger part in environmental issues, again, especially because we're short-staffed. So trying to be as part of as many coalitions as we can. And I think, that's where I tried to write everything down so I didn't forget. But those are some of the ways that we've been involved. Oh, and the last thing I'll just say, we're part of a press conference earlier this week on the federal clean car legislation. So we try to, where appropriate, get in on the federal level too.
Yeah, I'll add to that since you brought up the federal, Heather. One area that I am interested in, and I've spoken a bit about, we were reached out, or the media reached out to us this summer when we had some extreme heat days, and talk about the health impacts of extreme heat, which of course we know the climate, the world is getting hotter every summer. And looking at LIHEAP, the federal program that provides the energy assistance in the winter, so that your heating can't be turned off. But at least in Iowa, I'm not familiar with it elsewhere, but at least in Iowa, it doesn't apply to air conditioning in the summer. And so that's an area that we've gotten more involved in is in cooling, and kind of sharing the importance of city design and urban planning and complete streets, and this kind of, and like the tree canopy and urban tree planting and such, and showing how all that has a direct impact on not only the environment, but in health. And one of the policy areas that I would love to start working on, it's kind of a pipe dream here for right now, but is in getting LIHEAP to fund cooling in the summer, because we know that it's such an important health issue.
All right. Well, I'm sold on the fact that state affiliates are really important, just from hearing the media advocacy, the policy advocacy. So, the last question we have for you all, and then we can open it up, is really why should folks engage? A lot of local public health folks are busy, don't have extra time, but are there ways, how do you recommend people might engage with their state affiliates and get involved?
Go ahead, Heather.
And I keep forgetting to mention, I'm also on the Council of Affiliates as a policy at large position, which we're going into its second year. But in that role, I'm happy to be a liaison to help you all in different member sections, get a foot in with some of the affiliates or learn more or set up opportunities like this too. So I'm a resource in that capacity. But I would say, I think becoming a member of your state's association is definitely, a great first step. If they have, like we do, a member section, getting involved that way, volunteering to, give testimony, get involved in advocacy. We're always looking for additional voices from that front. And then, looking to see what events affiliates might be sponsoring, and attending those too are great learning opportunities. I also feel like affiliates are very responsive to their members. So if there is something that your affiliate isn't addressing that you think they should, I wouldn't hesitate to reach out to them. I feel like we're a really nice crowd, I like to think, and just really care about public health and the environment. So definitely, don't be afraid to reach out and ask questions and get more involved that way. And then someone I saw put in the chat about the LIHEAP and cooling as a policy statement. I think that's another way too, and we're trying to work more on this, is getting affiliates involved in the policy statement creation process. So if you all are working on any, either as a section or individually, I think it would be great to try to tap into affiliates, whether it's Lena and myself or others, so that you can get more of the state and local perspective too, could be super helpful. So those are just a few thoughts.
Yeah, I echo everything Heather said. And I would say, I mean, state affiliates kind of epitomize the think global, act local aspect. So many of the issues that, and I love being a part of APHA. I love annual meeting. I get so energized when I go. But I often find that I need to put a local context on what we're talking about at APHA, because it's so important, but it's up here, you know, and your state affiliate helps bring it down to that local impact. And it's a great way to get involved. And if you're faculty, you know, you have your teaching, your research, and your service, your affiliate is a great way to get that service leg of that stool. Influence state level policy, as you saw on our annual conference. I mean, those sessions were curated from our membership. They were abstracts submitted by our members to share what they are doing locally. And so it's just a great opportunity to take your knowledge, to take what you know that's happening at the national level, bring it down to implement and see immediate reactions at the state level, and then also to run it up, you know, run it back up. So we are connected with the APHA and the national policies. We participate every year in the Speak for Health campaign, which is we bring together our affiliate members across the state and speak with our congressional delegation and talk about issues that are important to us locally, but then have national impact. I think it's just a great opportunity for you to expand your network, especially if you're a young individual, start early in your career. It's a great networking potential and a way for you to build leadership as well. If you're looking to make those kind of next steps in your career path, if you're a young professional. It's a great way to engage with students and see when we have a strong relationship with the university. We have 3 universities in our state that have MPH programs. So we have strong relationships with them. It's a great way to get in touch with students and know what they're doing and kind of what the future of their career is as well.
Fantastic. Well, I'm going to stop recording. So thank you for letting me